Well, being diabetic, I've had ongoing problems with my foot. It's been 37 years, and just the last 15 or 18 years, I've had some problems with foot ulcers, and as active as I am, it was hard to get them to heal. And I'd been to a few doctors that told me they wanted to take half my foot off and my foot off at the ankle, and I found Dr. Mobarak. He took a look at my foot and asked me about my lifestyle, asked me a lot of questions that a lot of other people just neglected to do.
Human-derived skin graft is pretty much a skin that's freeze-dried that comes into our office. Has been administered from another human skin or part of their body. The typical one that I use in the office is still from their first donor. It's been out for over 10 years, so they're still replicating the same cells and making the skin graft. I use the skin graft primarily for diabetic wounds, and it has speed up the process by 30 to 40%.
He worked with me to heal the problem, not to just chop it off and let me go on about my business. I really appreciated that from him. He was the first doctor I'd talked to in a number of years that gave me that kind of hope.
Doesn't look like skin at all. It's kind of like a gooey, meshy type of substance that you just place on the wound after it's been cleaned out and basically debrided, and we put a good compressive dressing on.
He decided he wanted to do what's called a dermagraft on my foot, which is a skin graft.
I first met Kirk 4 to 5 years ago, and he came in with infection to a couple of his toes, and I said, look, instead of doing amputating your foot or your leg, let's take these 2 toes off. I mean, the infection's already gone deeply into the bone. Majority of my patients, after their first application of graft, the wounds healed by 50% after the first week.
He did finally, with the dermagraft, get my foot to heal. This is the longest I've been off of crutches in the last 5 years. You know, if I knew anybody that was going through the same thing that I was going through and having the same problems, family member, friends, somebody I didn't know, I would absolutely refer Dr. Mobarak to them, and he's the best foot doctor I've ever had in the last 37 years of being diabetic.